I'm here at the Perelman Center for Advanced Medicine at the University of Pennsylvania. And it is a very happy day here today. I happen to be here when the Nobel Prize winners were announced. And here they are, Dr. Katalin, Karikó, and over here, Weissman. They won the prize this year for physiology and medicine for their work in basically unpacking the fundamentals of messenger RNA, which is leading to this whole universe of new vaccines and treatments and different therapies that use mRNA that are coming. So just incredible to be here today, but they're not actually the reason for my visit. I'm here visiting another guy. His name is Dr. Kiran Musunuru, and he's doing astonishing work in cholesterol and basically doing gene editing to reduce our risk of heart attacks. Just spent an hour with him. What an amazing human being. Essentially, he started down this track of saying, how do we help people who have hypercholesterolemia, who have or produce too much cholesterol in their bodies? And he's looked at all the pathways to helping them, all the different medicines, all the different ways we can attack the amount of cholesterol in the blood or the amount of cholesterol being produced, statins, these sorts of things that they give people when they have a heart attack and they go to hospital. But they have to take those medicines every day, forever, effectively. And he's said, well, why don't we move up the supply chain, if you like, to edit the liver and actually reduce the cholesterol your body's producing forever, for the rest of your life. A one-shot and done deal. Now, I met Kiran a year ago at MIT and watched him present, and I knew his vision was big, but I had no idea how big, because he's starting with those patients, those people that really suffer from producing too much cholesterol. And by the way, this sort of issue of cardiovascular disease is a combination of genetic factors like theirs and lifestyle factors, including pollution and diet and all those things. So he's attacking the genetic factors because he said, how can I go beyond just helping them so that I can give a treatment to everybody that has a heart attack? So they have a one shot and it's done deal to reduce their risks for the rest of their lives. And then he's going further. He's going to develop that, and he believes the treatment will be appropriate to anyone who has any familial risk for heart attack, any genetic disposition to heart attack. And then ultimately, it should be something that's available to anybody on the planet. And why this really matters, and why I expect him to win a Nobel one day, is that the leading cause of death on this planet now is cardiovascular disease. In all geographies, not just the United States, everywhere in the world, it is now the leading cause of death. So he's looking at a one-shot gene editing therapy, which will change the cells in our liver, change just a couple of letters, switch them off if you like, so that we reduce the risk of heart attack in anybody that has the treatment for the rest of their lives. In terms of impact on life expectancy and life quality on this planet, possibly there is no other treatment that will have as great an impact in our future. So there's a couple of glimpses into our future. And the extraordinary thing about this place here at University of Pennsylvania is that there's even a third reason I'm here. The other day I spent time in the lab where they're looking at immunotherapies to attack cancers. And I've been following that story for many years. And I was here with the Whitehead family because Emily Whitehead was the very first patient as a young child to be cured of her acute lymphoblastic leukemia through gene-edited T cells. Her immune cells were edited to attack and destroy her cancer. And she's 11 years cancer-free now. So we're having a bit of a celebration of that. And I got to tour the lab and meet some of the amazing doctors who were behind that. In particular, Bruce Levine, who I'll interview in the podcast soon, and Don Segal, and another guy called Carl June. They were the pioneers of that therapy. So all of these things, all is a confluence here at this particular hospital. And I don't know what they're putting in the water here, but it's obviously fantastic, and this particular research facility. But Kiran Musunuru, that's the name to watch. I'm going to share more of what he's done and the whole interview, of course, and the podcast in the coming weeks. But there's just a little bit of inspiration to kick off your day. 2 Nobel Prizes, 3 different branches of medicine, all shooting off to change and rewrite the rules of our future.